This is one thing. The cut that I usually tend to take is a 2 plane cut, because if you go with a saw and you try to make your cut like that, it's most likely that you're going to skid, and then you can actually take off your greater trochanter. So mostly I take about maybe 2/3 of the thickness of the neck, and I stop, and then I go with a saw, with an osteotome, a sharp osteotome, right inside the greater trochanter. The beauty about the posterior approach is that you don't touch the abductors. So anything that's outside your greater trochanter is a no man's zone. You shouldn't go there. And anything that's inside, you're fine. You can play with this area the way you want. This is one point. The second thing, if you are going to be using one of those shoulder thing,
Colosseum.
Yes, collar. I'm losing my mental brain. If you're going to be using a collar, you want your stem to really sit when you bang it down on the collar side. So if you're going to be using a collar from the beginning, you might as well just take a cut which is smaller, like maybe 2 or 3 millimeters above the intended level. Why do we do that? Because at the end of the day, your rasp will go below your cut, and then you're going to have protruding pieces of bone. And then we always have something called the calcareeming, and then you can go with the calcareeming that will shape the neck exactly to the level where you want to put your stem. So this is one thing to do if you're going to be using a collar. So the way it goes is depending on your preoperative planning. I like to tell my assistants that all femora were designed according to my thumb. This is what God did to them. So basically, if I put a thumb above the lesser trochanter, that's the level of my cut. And so that one will go at right angle to that surface. And it takes more or less the orientation to the femur, whereabouts you want to put your stem. Okay. Once you've done that, then you go with an osteotome. We don't have an osteotome, so I'm going to use this saw instead. And you go like that. And this way, you're away from the greater trochanter. And that's it. Okay? So we're going to start to work on the femur. Now, remember that the femur is not straight. The femur has a bit of a bow. So if you're working with a posterior approach, then the bow is going to the floor. If you're working with an anterior approach, it's the other way around. And the projection of the center of your medullary canal is not in the center of your femoral neck cut. It's on the posterolateral corner there. So it's right there. This is beautiful. Oh, yes, this is excellent. So it's right there, and it's not here. So if you go from this area, you're more likely to hit the posterior cortex of your femur. So basically, the way you want to do it is you want to go on the outside about this area there. So you need a sharp sort of something like this. I tend to use a nebular, but in this particular case, I'm going to go in this area there. So it's in the posterolateral corner, exactly like this. Now, one of the things I've learned with the plastic model is that I shattered the plastic models much more than I shattered the femora. Thanks God.
Coming.
It's coming.
Yeah.
Nice. That's it. Nice.
Yeah.
Okay. So this is when I start to open the femur there. As you've seen, Sebastian was talking in one of the videos, I think in where he used the canal finder. You can either use a curette or something of the sort. I don't like to use curettes to go into the medullary canal. The reason B is that if I'm using a curette or a reamer, I do that with cemented implantation, because then I'm not really concerned about the cancellous bone that much. With a cementless implantation, I like to compact everything. I don't want to remove bone. I want to keep it inside and compact it. And then this is a very nice, beautiful piece of kit. And I hope I do not shatter that femur. One thing I need to start before I do that. What is the virgin? Okay. So in the posterior approach, I let my assistants put the leg up. So the leg is vertically like this. and if the leg is vertical, then if I go at right angle to that vertical plane of the leg, this is neutral.
That's 0. And then
that's 0. If I go like this, that's antiverted. If I go like this, that's retroverted. It's the other way around in an anterior approach.
And to help you, you have the lesser trough.
Yeah.
It's telling you where it's posterior anterior, because sometimes, obese patients end of the day. So
this is a nice place where you put your Homan to basically shifting and lift the femur. So let's so in this case, that would be neutral, that would be antiverted. And it's going inside, nice and beautiful, and it's went in. So the next thing I would do with that little piece of kit, I would start by doing this. This is nice, I like this. Can you keep this for me after I leave? Okay. Now, having done that, then I start with the first brooch.
So we go for a size 3, huh?
Size 3, okay. So I'll go with that. I see people hammering this way. That's not good. The hammer moves with your wrist. It's much easier and it's much more controlled. So what size is this?
That's 1.
That's 1. So you're going to go for the size 3? Okay. Yeah. Okay.
So what we're doing is we're compacting the cancellous bone. And you see that we are not removing anything. Just the thing is to be in the right version, and then you go bigger and bigger, or you're compacting. Don't put the curate and remove the cancellous bone, because that's not the philosophy.
Always sort of slightly push on the lateral side. Don't do that, otherwise you're going into varus. So based on this beautiful kit that you remove part of the lateral wall, you can actually go into neutral. Okay, and then yeah. Perfect. And so you push like this, and you slightly lift very gently your brooch so that you go along the bow and you don't hit the posterior cortex. That's better. So at the end of your brooch, what I do is that I test the rotation. So I basically do a little bit of rotation like this, and if it's actually holding well, then that's probably the right size. Okay? Don't overdo it, because if you've got a little bit of soft bone and you keep on overdoing it, you can actually ream it out. And then
what you need to know about your system is how the final stem is going to sit compared to your brooch.
Yeah.
That you're going to learn. That's a sawbone, so we don't know.
Yeah.
Usually on this